nurturing, courageous, enduring. All have been hallmarks of Tallahassee Memorial since 1947. Medical advancements have improved healthcare, but it's the care and compassion of TMH colleagues and staff that make the critical difference.
Me and my husband were driving back from Tampa, and I got this call from the guy. Didn't even introduce himself. He was just like, "Are you Jenny Schul?" And I was like, "Yes." And he's like, "We're trying to get a hold of your mother. Where's your mom?" And I was like, "She's babysitting my son. You know, what's going on?" And he told me that my dad was at the Northeast TMH ER, and he was having a heart attack. I felt helpless, you know. I mean, I'm on I-75. How can I help my mom, you know? And because I knew my dad was in the best hands that he could be in. He was at TMH, so I knew that I didn't have to worry about my dad. I was just worried about my mom. So he was going to need triple bypass surgery. You know, the next morning he's doing great. He's sitting up in his chair, you know, and because we did have a lot of fears because of all his previous medical issues. So with every new person, they sat with him as he told them the story over and over. We must have heard his whole heart attack story like 1,000 times because he's like a grandpa. He tells you the same story over and over. But yet they sat with him, they listened, and I know they had like 1,000 other patients to deal with, but they made him feel special and listened to his story, and they just make you feel more at home rather than in a hospital. When you go to TMH, you get the best doctors, the best care, and so there's no hesitation where we're gonna go when we need to be treated.
In 2011, I went and had my mammogram done and got a call back to come and do a biopsy. Went and done my biopsy, called me back 3 days later, needed me to come back and do a second biopsy. I was diagnosed with triple-negative stage 2 breast cancer. I have 4 daughters, and my oldest daughter was getting ready to graduate from high school. So I felt I had so much to live for, and when you hear the word cancer, automatically you think death sentence. I underwent about 6 to 8 hours of removal and reconstruction, all at the same time on my 48th birthday. That morning, arriving at 5:30, I was an emotional wreck. One of the anesthesiologists remembered me from a previous surgery that I had. And that kind of took the edge off the worry and the anxiety of having to go under that many hours of surgery. Very hard, especially for my youngest daughter. I remember coming out of recovery and I hear this cry. And so she leans over to me and I kiss her and I tell her, "Mom's okay, Mom's okay." You see your mom, you know, and you love your mom, and she had never seen me in that particular state. And Nurse Helen tells her, "Mom's okay, Mom's okay, Mom's good, Mom is good." And she stops crying. To have someone there from your staff to reassure her that I was good and that I was okay. Those are moments that you thank God that someone is there to reassure them that their parent or their loved one is okay.
It happened February 28th of 2011. She was riding a four-wheeler and she missed the stop sign. She got into a dust cloud and missed the stop sign and pulled out into oncoming traffic on one of our highways in Bristol and was hit by a pickup truck going 60 miles an hour. And it caused traumatic brain injury. They lost her about 7 times between Bristol and TMH. The ambulance drivers looked at her and they called her in as a signal 7, is that she's dead. It's been a long road, 5 years. She has had well over 28 surgeries. We've always been close, but now I didn't think she'll be 20 in October, and I didn't think that at 20 we would still be spending 24 hours a day, 7 days a week together, but I wouldn't trade it for anything in this world. I love every minute of it. the whole time we were in ICU and PICU. Even when we went out onto the floor, we never had a bad nurse. We never had a nurse that we didn't feel like loved Clary and loved us, and we fell in love with them, and we want to tell them thank you so much. Thank you for everything, for going above and beyond, and, you know, just for the extra words of encouragement. You don't know at the time how much it means to the family, because there's a lot going on, and we may not be able to tell you right then, but we want to say thank you so, so much.
Our job is to take care of patients, to take care of this community, take care of all the surrounding communities for all their medical needs. And that means taking care of their surgical problems as well, whether it be trauma or elective surgeries. We do a great job now, but having a more modern facility with more modern equipment will only allow us to do that better.
Our ICUs right now, we do a great job taking care of our patients. We provide quality care. It is a safe environment. But we know, in looking at the MT Mustian Center and the future of ICU care, that there's technology, there's innovations, there's many, many things that we can do bigger and better. So that is our plan for this new center.
I think that we all look forward to new buildings, new facilities, state-of-the-art equipment. I think what we do now is excellent, but this will allow us to even be perhaps better than that. And you always strive for better, and I think that will allow us to do so.
So the planning's been going on for a couple of years. We have looked at drawings, talked to architects, had lots and lots of meetings with them. And then there were the mock-ups built.
The mock-ups were very good. It was it provided us with the ability to go and see what the rooms are going to look like, real time, where the equipment would go, get everybody that is part of a critical care team inside a room and see really what space we were dealing with, and it was great. It really helped us to put things into perspective.
Nursing has been involved from day one. The two nurse managers of the ICUs have been at the table every single meeting, every single time. They've been involved in the mock-ups of the ICU rooms and the placement of the furniture, and in addition, our patient family advisors have also been involved. They've been involved in looking at the patient's family area, where the family can visit, is there a place for them to sleep? Is there a place for them to plug in their electronics while they're visiting their loved one? So we have been at the table, and it's been very exciting.
Long hours, and many, many hours after work by our physicians, nurses, and staff, yielded a vision and innovations not just for today, but for tomorrow. The result is the future of surgical care to span generations, the MT Mustian Center.
Well, I think the new OR space is going to give us a great opportunity to bring some new equipment in to Tallahassee to increase our capacity as a facility to take care of trauma patients, to take care of orthopedic patients, and every other specialty as well. Just having the physical space with every operating room being big enough to do a big case will really increase our ability to get patients taken care of in a timely fashion and a safe fashion.
One of the things that we did when we looked into development of these ICU rooms was, what was the evidence out there about what was the best patient care we could possibly provide? We know that a healing environment, a quiet environment, an environment where there's privacy, we can provide dignified care. We took all of those things into consideration in designing these rooms.
Our goal with this building, I think, is to provide a building that will put us on par or above any other medical facility in the Southeast. I think we will be able to provide a facility that will last for years and years and keep us at the cutting edge of medical care for our community.
Healing. It's more than just medicine and technology. Compassion. It's the emotional, spiritual, and physical bond unique to mankind. At TMH, these relationships last more than a lifetime. They have and will span generations.
TMH is my hospital for life because there is no other hospital. If you think about the care and the love And the staff here, there's no other option. I mean, you just know, and we all want the best for ourselves and for our family members. And if you want the best, you just go to TMH.
I am here today because of TMH. I am a breast cancer-free survivor for 4 years because of the service I got here from the many, many angels that are working here at TMH. TMH is my hospital for life.
TMH is my hospital for life because it's where I gave birth to Clary, not once, but twice. I had her back in 1996 at TMH, and then TMH made sure I had my baby again in 2011. So TMH is my hospital for life.